So that's your choice. Thank you. Okay, I haven't changed this. I do apologise. We haven't got Helen with us today. She's having technical problems with her computer. So today we have Mandy and Dan with us to help us if I need them. Today's guest speakers are Will Harris, one of our team, who's going to talk to you about testing. And also we have Alexandra Burkett from the Health Watch Torbay. She also has her colleague Abby with us, who's going to help her. We will give you an update on the numbers in Torbay, and Will's going to do his chat, then Alexandra and Abby, and answer any questions that you've got, and then we're going to do a poll about going forward, and then just the last little bit. You keep yourself on mute unless you're speaking. If you want to speak, please raise your hand. If your signal is poor, it may be worth disabling your video, as that sometimes helps. Please post your questions in the chat and we'll try and answer them. This is an open forum, so please be friendly and kind. But if we cannot answer any questions that are personal or political. If there's anything else that you'd like to speak to us about, there is the email champions@torbay.gov.uk. If you have a question, on the tabs is the chat. If you could put it in there, that would be fantastic. If you want to raise your hand, if you click on the participants bit, and it is on there. Okay, what are we asking you to do? We're asking yourselves and to work along with us to give the information to your neighbours, your friends, your families and your colleagues so that they can pass it on. This is so we can get out the important and credible information that needs to get out there with COVID at the moment. Okay, so the window stickers, woohoo, I've gone, hopefully are going out in the next couple of days, should hopefully be with you next week. We were just confirming that, and it looks like they should be out. And then we'll start emailing you with your certificates. Okay, Torbay and COVID-19 latest data. It's looking very good at the moment. Cases remain very low. Number of cases in the last 7 days. From the 28th of May, it's 15 cases. It has gone up slightly, but that's obviously because we're now out and about, but it still remains very low. There's no COVID patients during May at Torbay and South Devon Hospital, which is fantastic. And approximately 4 in 5 Torbay adults have had their first dose, and 2 in 3 Torbay adults have had their second, so that's brilliant. There have been no COVID deaths registered in 7 of the last 8 weeks.
That's good.
Yeah, it's been brilliant. It really is good news at the moment. Okay, I'm going to stop sharing my screen, and Will, if you wouldn't mind doing your little bit. Thank you very much.
Sure, thank you, Kirsty. There we go. For those who don't know me, I'm Will Harris. I am the project manager. I work in the COVID response team, and I'm in charge of the community testing program. So it's the testing, asymptomatic testing, I must stress, for residents and workers across the whole of Torbay. So if I just move on then, so he says. So firstly, I'll cover the types of testing. So there are 2 types of testing, symptomatic and asymptomatic. And I do believe I may have just, no, apologies. So firstly, symptomatic testing. The symptomatic testing mainly uses the polymerase chain reaction tests, PCR tests, as they're more commonly known as. These are only for people who show symptoms. So whether it's continuous cough, fever, etc. There are strict criteria for those who can use PCR testing. Some of them I'll put up here. So if you've had, for those who've had a positive lateral flow device test, I'll come on to that more in a bit. Those who've been advised by a GP to get a test. Those who have been in contact with someone who's tested positive. Those who have been asked to get a test by local council or someone from local test and trace. There are other criteria surrounding that, and that information can be found on the government website. The link is at the bottom of the screen there. It must be stressed that these tests cannot be used for travel overseas. So although people who travel overseas have to get a PCR test. They cannot use the free NHS tests. It's got to be done for a private company. The other type of testing is the asymptomatic testing. So this testing is for people who do not show symptoms of COVID. So 1 in 3 people who have COVID do not show symptoms and therefore unaware that they'll have COVID and can unwillingly or unwittingly pass on pass on COVID to others. The asymptomatic testing is primarily primarily for those who do not show symptoms. It uses the lateral flow device, commonly known as an LFD, also known as rapid antigen tests. They can only be used by those aged 11 years old or older, so secondary school age and above. And they're for use by those who have not been told to self-isolate. So if someone's been told to self-isolate, the only tests they should be using are the PCR tests. And these tests should be conducted twice weekly, so once every 3 to 4 days. If you require further information, the link at the bottom there will take you through to the government website, and that will provide a lot more information on the asymptomatic tests using LFDs. So the available testing methods, available testing routes for those people who are symptomatic. You've got the local testing site. We have one located at Claydon Valley car park, and this is managed by Serco on behalf of the Department of Health and Social Care. We have no control over it. We have very little to do with it as a local authority, although we do have contact with that site via Department of Health and Social Care. There's also a mobile testing unit. This is currently located at Limited Road bus station. It is there most days of the week. However, they do have a day off once a week. So I think every 6 days they'll have a day off. But it's there 6 out of 7 days of the week. The other way of accessing the PCR tests is to order them online. And you can order online via the government website, the link of which is down there. For the asymptomatic testing, there's currently workplace testing. This is led by Department of Health and Social Care. It's not available anymore. So businesses and organisations such as charities were required to register by the 12th of April in order to get hold of the test and to start testing. However, something that's not been communicated well, as far as I'm aware, by the government is that come into this month, that testing comes to an end. And that also includes Workplace Collect. So Workplace Collect is the test kits are sent direct to the business for the staff to test at home. So the home testing kits that's sent to the workplace. We also have then the community testing program, which I run for Torbay. And this covers a variety of schemes. So we've got workplace testing, which is led by ourselves as a local authority. It's a bit more involved. So businesses who register with us have to conduct a risk assessment. They have to go through a number of documentation. The criteria is quite strict as well, in the fact that we're more involved, which is actually to the benefit of the business, because we ensure that everything is conducted safely, and we can offer more tailored advice to businesses who register with us, and it's still open now. So we're still able to provide free test kits to businesses who sign up with us for workplace testing. We also have asymptomatic test sites, or ATSs as they're more commonly termed. We started off with one, which was located at the Key West car park in Paynton. That has now changed. So we moved from a fixed site to a mobile option. The picture which you can see there consists of a van and a gazebo for protection from the elements. And we currently operate 3 sites, one in Brixham out of Central Car Park, one in Paynton, which is the Key West site, which was moved from a fixed to a mobile. And we also have a site in Torquay, which is on the harbour side on Vaughan's Parade. There is a second location we're currently trialling, which is Lower Union Street, and that's every Wednesday. So the sites are open Monday to Friday. So Key West is open every Monday to Friday between the hours of 8 in the morning and 5 in the evening. The site at Brixham is open every Tuesday and Thursday for the same time, 8 till 5, and the Torquay site is open every Monday and Brixham's every Monday and Thursday. Torquay is every Tuesday and Friday, and then the Wednesday is at the moment just the Lower Union Street. The other scheme there is the Community Collect. So this is the home testing kits, and home testing kits can be collected from the LTS in the afternoons, and that's open 7 days a week, Clenham Valley, and also from one of our mobile ATSs. The test kits can be collected there. There's also the option for pharmacy collect. So we've currently got 30 pharmacies across Torbay, which provide home test kits. There's no requirement to book. People just turn up and collect a box of 7 test kits. Another alternative is test kits direct. So it's there, it says online. Actually, you can call 119 and order test kits via that option as well. With regards to the pharmacy and the ATSs, if you want further information as to which pharmacies are currently offering the free home test kits, then if you go onto Maps Test and Trace NHS, that'll provide you with either a list view or a map view of all the pharmacies across Torbay and our ATSs, which offer out free home test kits. Does anyone have any questions?
It's Nigel, totally blind gentleman. Just a couple. Has the website been updated of where these pharmacies are? Because I checked it a couple of weeks ago, and I know I did email into this forum that it was only showing 2 in my area, which is Torquay, which is a bit strange.
It has been updated, so I went into it late last week to put up a list of all the pharmacies that are currently operating the scheme, and there are 30 separate pharmacies across Torbay which are now registered on that site.
Also, your mobile unit, is that the same one that used to be or still is in the car park of the library in Torquay?
So that library car park, we've never had a mobile test van.
Well, someone is in there, been in there for people to be tested.
There's one in the coach station car park.
Yeah, I know that one, and there has been. I haven't seen it recently in the last couple of weeks, but there has been in one in the library car park.
Only time we've had a van in the library car park has been to collect test kits from our distribution hub. We don't operate any form of testing for the public from that location. That's interesting. I'll have a look into that. Thank you. Do you know roughly when it was the van was on in the car park?
Must have been at least maybe 3-4 weeks ago, and the only reason it was obvious because they had people on the pavement guiding or getting people to go in and get tested.
Okay, that's interesting. Would you mind send an email through with the details, please, Nigel? I want to look into that.
Yeah, I'll send it to the forum. That's not a problem.
Oh, brilliant. Thank you.
If I notice it again, I'll get my wife to let me know. But as I say, it was interesting. It was there, and it was there for a few days on a trot. Then as I say, we haven't noticed it recently.
Yeah, that wasn't one of ours, and as far as I'm aware, it's not one of the Department of Health's either. That's a bit concerning, actually. No, thank you for letting us know.
Will, how many sort of test kits are you getting picked up? Are people collecting them from you? How successful has that been?
It varies week to week. So it could be as low as 100 a week to as many as 300. We have 310, 311 last week. And it's not just residents, we're getting visitors collect test kits as well. So when people collect test kits, we ask for their postcode, just so we're able to track who's collecting test kits and for what areas. We've found that a number of postcodes, people as far away as Blackpool who are coming down on holiday are collecting, or I say on holiday, that's a bit of a presumption there. It could well be visiting professionals who are down here for business, but we are seeing people from outside Torbay collecting these test kits.
And that's good to know that they're doing that. If they're coming down on holiday, hopefully they're still testing while they're down here.
Yeah.
Nigel, another question for you. When these people test, I've noticed they do it 2 different ways. Why?
Sorry, what do you mean with 2 different ways?
I knew he was going to say that. What I mean is normally they swab the back of the throat, and then some use the same one for one nostril, some for both nostrils. Why? And what's the difference?
Okay, so it's encouraged that people do a throat and a nasal swab to get the best results. However, some people do have a bad gag reflex, so much so that they can be sick, which is something we want to avoid. So therefore, the next best alternative is to do a double nasal swab, so a swab in each nasal, each nostril. Sorry.
That's understandable, but what I mean is they're actually doing a throat swab as well as either 1 or 2 nasal swabs.
They shouldn't really be doing that. They should be either a throat and a nasal swab or a double nasal swab. There shouldn't be a throat and a double nasal swab. I suppose you have to know where you saw this happen.
Yep, my wife, Torbay Hospital.
Oh. Well, I can't answer that one. It's if NHS have a different protocol, they shouldn't do. But no, but maybe they do.
And the only reason that happened is because a community nurse did it at home the day before the normal way, throat, 1 nostril, and it got contaminated in the system. So she had to go the following day, and that's when the hospital did it themselves.
Oh, I must admit, I've never heard of that. I've not seen any guidance to suggest that that's the test that we conducted. But then again, the NHS may have a separate protocol. All the protocols we have come directly from the Department of Health and Social Care.
Okay, thank you, Nigel. Anyone else got a question for Will? No, okay. Well, thank you very much, Will, for that.
Thank you.
Yes, it's interesting all the different ways that where you can go. That's the difficult thing of not knowing where to go. So it's good that we've got the websites where all that information obviously is being held. Fantastic. Nigel, have you got those email addresses?
Yeah, I got them on the an old system, which actually, and that's why I queried about the list of pharmacies, because I wondered, because I have to use the list view and not the map view if they weren't compatible for some reason. In other words, if they were all showing on the map system but not the drop-down list system. But I will look at it again. But of course, at the moment, my pharmacist has started very kindly sent me a text telling me they stock them now.
Oh, fantastic. Oh, that's good. That's good. I'm glad they're doing that. That's worth knowing. Okay, right. Thank you very much, Will.
Thank you.
I'm going to share my screen again. And I'll introduce you to Alexandra.
Yes, so hello, everyone. My name is Alexandra Berket, and I work for HealthWatch as a project officer. I am here today with my colleague Abby Reid to talk to you about our new initiative that we launched a couple of months ago about the HealthWatch Assist Network. Could I have next slide, please? Okay, thank you. For those who don't know HealthWatch, we are the independent consumer champion for people using local health and social care services in Devon. Could I have a next slide, please? So local HealthWatch organizations were established as fully independent bodies. So although there are 152 different HealthWatches across England, these are all set up and run differently and are independent of each other. So we do work in collaboration with everyone, but each of the HealthWatches does their own thing and has their own agendas. And every local council is obligated to have a local HealthWatch. In April 2020, HealthWatch Devon, Plymouth and Torbay were jointly commissioned by the local council. And although these 3 services are jointly commissioned, we still have local identities for each HealthWatch. So there is still HealthWatch Devon, HealthWatch Plymouth, and HealthWatch Torbay. It's just the staff and the management team are working across those 3 health watches together, which provides us with more joined up way of working. We also have a partnership with Citizens Advice Devon. So we have got some champions who provide specialist advice and guidance on health and social care related matters. We have a frequent number in use. So if you have any issues or specific problems, then you can ring and get advice or guidance on those health and care related issues. Can I have a next slide, please? Thank you. Okay, so HealthWatch is really all about providing accurate information about local services and engaging with all the local communities to share information and gather feedback, and really allowing the members of the public to have their say on local health and social care services they use. We then share that feedback with people that are in position to make changes to those services and can also improve standards of those services. We make people aware of their rights, how to complain and seek resolutions, and we do a lot of that work through our partnership with Citizens Advice. We provide people with a chance to hear about our work and what we have achieved. So to gather information and feedback from people, we have to evidence where that information has gone and what difference it has made. We also have some volunteers who work with us in different roles. So if someone would like to hear more about the volunteering opportunities, then you can always get in touch with us, and I will talk in later slides what is the best way for you to get in touch with us. Could I have the next slide, please? Thank you. So the main reason why I am here today is to talk about our new initiative, which is HealthWatch Assist Network. And HealthWatch Assist Network is kind of similar to the Torbay Champions because we're trying to interact with people from different communities and become a vital network of information. So basically what HealthWatch Torbay is looking for, we're looking for community groups, any support groups or centers to join our HealthWatch Assist network and just become part of our vital network of information. And this network allows us to build links with communities so we can gather information about health and care services they use. So we simply want to know what is and what isn't working. And this information is fed back into the community and then shared with the key healthcare decision makers who can learn from good practice and make improvements to local services. So as a member of the HealthWatch Assist network, what can you expect from us? So you can expect a website link and tag on Assist map with link to your website. I will explain about that later on in later slide. We will engage with your social media messages and will share appropriate things to our wider network and to the public. You can expect a small feature in our quarterly voice magazine and in our monthly e-bulletin. And if you will have any upcoming events and would like to share it with us, then you can always get in touch and our comm team then would be able to help with that. We will signpost people to your service where appropriate, depending on, of course, on what people are getting in touch with us about. We will keep you updating with national and local health and social care issues through our website, email and newsletter once you will sign up. And you also will be the first one to know about any upcoming events and opportunities to raise awareness of what you do. And we also try to reach our assist network first and let them know about the piece of work that is coming up, and we give them the opportunity to get involved in things. You will also get an invitation to attend our HealthWatch quarterly network events. So hopefully not long it will be face-to-face events. And of course, you will also have the opportunity of acknowledgements in our reports if we did any partnership working with you. Can I have a next slide, please? And what we would like from you as a member of the HealthWatch Assist Network. So ideally a link from your website to ours, but we understand that some organizations or support groups don't have a website, so it's not possible to add that function. Equally, for you to engage with our social media messages, if you see message on our social media that is relevant for your members, it would be great for you to share it with them. Attend our HealthWatch Assist network meetings as much as possible, of course, and help us provide with feedback to inform the work that we are doing. If any of you have the newsletters or bulletins regarding to your members or audience, it would be great if you could mention HealthWatch in there too. It would be very helpful for you to sign up to our newsletter and share it within your organization or the community that you are a member of. Signposting anyone to HealthWatch Devon, Plymouth and Torbay, so they may be able to get extra information or help support they may need. Participating in our surveys, research and focus groups, and just keeping us informed about any events that you have coming up. So then we will then post that into our e-bulletin. And the last thing, but I would say the most important, is basically it's all about helping us ensure the voice of local people is heard. Can I have the next slide, please? So far we have 62 organizations that signed up and became the assists. We have a new updated section on our website, which there will be more information being added to. And as you can see, we have a little image on the map set up on our website, which maps up all of the assists and also demonstrates the spread of the assists. And a link from that map to your either website or Facebook page, whatever it is that you provide us with, and we'll post it a little bio, a short description of your support group and the organization. Can I have a next slide, please? So my colleague David has been helping to develop a new grant scheme, which is all about enabling us to work more closely with our assist members, which is what this HealthWatch Assist Network is all about. So we understand that some organizations or support groups or charities may be worried about the funding and sustainability all the time. So we would like to do our little bit to help with that. And we are planning to set up a small grant scheme just to facilitate any research or investigation you feel is important in your area, but need more capital or resources just to start up that process. And I don't want you to get too excited about it in terms of the amount of budget, but at the minute we are looking at £250. Just hopefully enough to have the basic costs of running a small survey or renting a local space, and basically any costs related to the engagement. And the grant for doing surveys or any outreach work would be a topic decided by you and the service user you are working with. It's very much your voice will probably help you with the engagement, but it's all about enabling you to get the voice from your locality to us. It's your agenda and it's your voice. We probably will not be able to cover the core costs or broader issues, and the funding arena and the criteria would be, I'd say, fairly bespoke to the purpose of gathering feedback from your local locations to us. So we will help you to promote it and report it. And the application process would be simple and fast-tracked, so there won't be too much of administration. And we are in the final process of signing off the package. So hopefully it will be available to the members of the HealthWatch Assist network soon. Can I have the next slide, please? Yes, so finally, I would like to talk to you about how you can share your feedback with us and get involved. So we have several ways that we gather a feedback from the members of the public and from the groups. The first is the rate and review service on our website, and this allows you to provide a feedback in relation to specific service. So it's almost like the trip advisor. We now have a new general feedback form on our website that would be possibly the method of feedback from when you got group meetings or somebody wants to provide a general feedback, but not in relation to any specific or multiple services. We have our free phone number that is in operation from Monday to Friday from 9 till 5. We have 3 email addresses, each one for each HealthWatch, which we monitor on regular basis. We also have a live chat function on our website. When you go onto the website, it should pop up at the bottom. And of course, you can share any feedback with us by participating in our focus groups and completing and sharing our servers with members of your communities. Can I have the next slide, please? Okay, thank you. So that's all for me. Sorry, I know it's lots of information. Does somebody have any questions? I mean, if you have any questions, then you can always email us, go onto our website. If you would like to find any more about the HealthWatch Assist, it will be at the top tab at the top of the page.
Nigel, will the website be on our fortnightly bulletin?
Yes, I will put that on there for you, Nigel.
Thank you.
Alexandra, what is your website?
So it's just HealthWatch Torbay. So then if you will type it in Google, HealthWatch Torbay, then you will easily find it. And then if somebody is from Plymouth, then they just will put HealthWatch Plymouth, or if from any other areas in Devon, then just HealthWatch Devon.
Okay. Thank you very much, Alexandra. Anyone else got any questions for Alexandra?
Just a very quick one. Where do you have your quarterly meetings normally?
So because of the pandemic, we had our first Assist meeting, and it was done remotely on Microsoft Teams. But we are hoping that because the restrictions are slightly being lifted, we're hoping that we will have more face-to-face interaction like we used to. The office for HealthWatch Torbay, we are based in Paynton Library, and before the pandemic, the public could just walk in and talk to us about any health and social care problems or ask us any questions. But because of the pandemic, the office been shut and we all been working remotely. So for the past year, everything we've done through internet really, but our free phone number is still in use. So if somebody doesn't want to use internet or doesn't have the internet, they can always call us on our free phone number.
Nigel, do you want me to give you that number now?
No, I can just attach it to the email. That's absolutely fine. Thank you.
No problem. Okay. Lovely. Is that everyone finished with questions? Can't see any hands up. Just checking the chat.
Yeah, I'm just picking up on people that have the internet. So if you go into the library, you can use the computers there. So I'm sure there's like information on the front desk on HealthWatch, so you could access their website from there too.
Yeah, that's brilliant. That's good that you can use that. Thank you, Paul.
Yeah, we also, if somebody is not very familiar with internet, doesn't know how to use it, we also have been very successful in running our digital health digital project, and our colleagues, we've got my few colleagues from my organizations and volunteers that help people, that teach them how to use, how to make an appointment, how to order prescriptions. So any health and social care related issue, we are there and happy to help.
It's brilliant, because obviously a lot of the doctor surgeries now are doing that, aren't they? And it's all online. Even for a basic appointment now, you have to go through a form, and
yeah, so we've been
everything
helping.
is now, isn't it?
Yes, we've been helping a lot of older people to navigate through internet.
Yeah, lovely. Okay, thank you very much, Alexandra. And
thank you very much for having me. Thank you.
No problem. Thank you.
Okay, thank you.
Okay, right. So for the next few months, obviously the pandemic is not over, and COVID is going to be around for some time yet, unfortunately, I think. Communication is key to the support community with this. It's key that we keep in touch. So I think it's important that we carry on with what we're doing. So how can we help going forward, and how can you help going forward? Okay, we've got a poll this week rather than questions, because we were looking at what's going to happen. This at the moment is our last forum. We're going to do a thank you one in at the beginning of July, but this is our the last one we've got with speakers. Okay, so can we have the poll up? Yes, please.
There we go.
Okay. Do you feel that the bulletin is helpful and has enough information? So these are going to be yes or no, most of these. Second question. Would you like to see the bulletin continue? So even if we're not going to continue the forums, but do you want us to continue the bulletin? Question 3. If the bulletin continues, how often do you think it's needed? Fortnightly or monthly? Question 4. Would you like it to include other subjects as well as COVID updates? So obviously there's going to be things going on. It's not always going to be COVID. I know we're COVID champions, but we could look at potentially other health things. We can also look at other stuff. So that's yes or no.
I think on question 3, at the moment, like COVID sort of is going down, but if there was a spike and we went to like monthly bulletins, that would have to be sort of flexible. So if we did get a big spike again, then you have to go back, maybe go back to fortnightly again.
Yeah, that's it. And also we've said we could do a forum if there was a big change in anything we felt was important that we need to get through to you. We would look at doing an actual forum for a face-to-face chat about it. So if there was that spike and we needed to get more information out to you, then we would look at actually doing a forum rather than just the bulletins. But we just felt doing the forums, obviously we've had lots and lots of different speakers, and now everyone's trying to get on to deal with stuff that's what's happening in the future, so that we can get some recovery done. So we felt that if we stopped the forums, it would be still important to continue the bulletin, but do a forum if anything did change. So yeah, Paul, we thought that would be
That's good.
Yeah.
Yeah, I think question 4, I think obviously they're worried about like a flu surge in the winter.
Yeah.
So I think, I'm not quite sure, but I think there's a lot of crossover between stopping flu spread, like wearing masks, and flu, and I know where they stop flu in the same way they stop COVID from spreading. But I think that if we do get that in the winter, then a reminder that people should wash their hands more often, and try to get that message across as well.
Yeah.
Try and reduce a big flu surge, because I think that we didn't have it last winter, but I think there could be one this winter maybe.
Yeah, that's right. I think because we've all been so good with washing our hands, and also the space and keeping away from people, I think that's obviously helped this year, isn't it? And we haven't had that problem with the flu. But you're right. I think as things settle down a bit and we go back to as normal as we can be, if we forget those things, you're right, we could have again. So that their hope is that if they, when it comes to the time for the flu boosters, getting yourselves involved and getting that message out, so that we would do the same sort of messages we've got going with the COVID, is that we could hopefully, with your support, get the more information out about the flu vaccine. So yeah. Okay. How are we doing with the poll?
It's all finished now. I'm sharing the results.
Excellent.
Can you all see it?
Yep, I can see that. Brilliant. Okay.
I'll stop sharing.
Excellent. Thank you. Okay. So yeah, so we will continue the bulletins, and we will look at whether we do it fortnightly or monthly. And if we do need to get things out to you at other times, obviously we know we've got contact with you all, and that can be sent out. Obviously, social distancing is still in place. Don't think the weather quite looks it today, but I think the last few days would have been quite nice to be in a beach hut. Not quite sure I'd want to stay in a hotel with Basil 40 though. Not for half term anyway. Key messages. Okay. Although we are now able to socialise more with friends and family inside as well as outside, we must remember to keep ourselves safe and abide by the rules, especially this week, as we've got a lot of visitors, haven't we, down to the bay. And it's looking good so far. People seem to be abiding by the rules and wearing their masks. Hopefully that will continue. Hands, face, space and fresh air. I think that's going to be our motto for quite some time, really.
So will shops continue? I mean, how are shops paying for all the hand gel that they provide as we go in? I mean, will that, if there's grants available for that, will they sort of continue post-COVID, try and get a new normal where people can wash their hand, use hand gel?
I don't know. I don't know if one of my colleagues knows how that works.
It's Nigel. I do know the coach companies, that's not the bus companies, the coach companies, they are still going to provide hand gel on and off the coach for the time being.
Fantastic. Okay. Mandy, do you know?
Yeah, we would advise that people continue with it, but it depends on their risk assessment. So at the moment, they've got to do a COVID risk assessment. So it will be part of their risk assessment. And obviously, depending on what changes happen in the future with the government, if and when we move into step 4, there may be different sort of guidance, but we would expect, that to sort of continue. It is a really good thing, but they do have to pay for it themselves, the businesses. So obviously it's an expense to them, but it's obviously good practice.
Yeah. I mean, you can buy once. I mean, they all sell it like, I think, is it 500 ml for like £1.99.
Mm-hmm.
If you bought the smaller ones, like the 99p ones, you can just refill them. That's what I do. Then I can keep one with me all the time. Then, if I need it.
Yeah, that's what I've done, Paul. I've got a large one, and then I just refill the ones because the children for school as well. So yes,
it would be nice to have receptacles. So when the little ones are empty, it'd be nice to be able to put them back somewhere. Because I'm sure, as a receptacle for with the gel in, I just use it to fill the other ones up, so it's perfectly clean when I finish with it. It'd be good if you can take it back to Lidl, put it into a bigger receptacle, then they can send it back to their manufacturers. It's Sienna, is it, I think it is, and they could just, wash it out and sanitize it and then refill it again. And
that would be good. I know that where I used to work, they did that. They went back to the company, but that was the individual company that did that. I don't know. Obviously, there's nothing like that with the supermarkets, which is a shame, really, because that would be quite a good idea instead of all the waste.
It probably saved them money as well, because obviously someone then has to make the actual containers anyway. So all you got to do is presumably just squirt hot water, got sanitizer in, like detergent in, dry it out, and then refill it with alcohol gel again, and that'll kill any of the bugs anyway. So
they'd be they'd be sterilised, wouldn't they, to be used again? Okay.
I think you'll find it's cheaper to put it in the recycle bin in normal circumstances than actually transport it back and treat it. This is happening a lot in other things.
Yeah, that's the unfortunate thing, isn't it, Nigel, that a lot of the time it is just the cheapest way that they'll do it.
Yeah, because because of we hiring coaches when we have to for what we do. I actually buy it in 5 litres, and also what people got to be aware of, there is a lot of different ones on the market. Some that aren't actually suitable because they don't have a very great alcohol content.
Yeah, they've got to be above 70 to 80%.
60, I think, or 65.
Okay, testing is obviously still very important, especially now we're having contact with more people and travelling around, and that's the important thing. We're going to have a lot of different people around this summer from all over the country, because there's going to be a lot less people travelling abroad, so they're going to be coming down to our seaside, unfortunately, but we just need to be aware of people moving around more. And then obviously then in September we've got movement again of schools and universities. We just need to wear, and obviously we've had the talk about where you can get your testing and get your kits. Please be extra kind, patient and respectful. No one's had it easy in the last year, and it is more important than ever that we remain together as a whole community. Okay, just want to thank you all for everything that you're doing and getting that information out to us. We need your help with 4 things. Share a fact with a friend from today. Share a post with your people, if you're on social media, that is. Get your champions badges and certificates. Fingers crossed they will, in the next week, we should have those. We are still looking for volunteers. If anyone did want to speak to Will via us to help down at the mobile sites, just trying to make people understand how important it is with testing. Just email us on the Champs email address.
Yeah, I've got an email in about that and the certificate things.
Oh, excellent. Yeah, if you do that, Paul, and then we can send them out to you.
What do I do? Just send them my email address, or do they send?
We'll send the badge out, if the stickers out, if you send us your home address.
Okay, cool. I'll do that.
All right, and we'll do that. Obviously, there's all the normal websites. We're obviously on Facebook. We're on Twitter. Our email address at champions@torbay.gov.uk.
Yeah, I've just shared the thing that came in the last email with the hands, face, space logo.
Yeah, it's a good one, that one, isn't it? That's the new one.
Shared that on the I'm not on Facebook or anything, so I'm on like decentralized social media, so I've shared it on there. So people on there, they're local, but it gets the message out there.
That's it. That's right. Yeah. Obviously, we have got all the information on the torbay.gov.uk website. Any other information, the .gov.uk and the NHS and also the WHO. I've got all the information on there. Okay, well, this one comes up saying a fortnightly bulletin and a fortnightly online forum meetup. Obviously, that's going to change in the near future, but it would be fantastic, obviously, to keep in touch with you all and still continue and have this contact. It would be fantastic. Just checking in there.
We just have one question from Joe. How long
Yeah.
do you anticipate masks, space, etc.?
We don't know, Joe. Obviously, we only know as much as you know from the government. We'll hear obviously in the next few weeks whether we're going to go to step 4 and what's going to be brought in for that. But there's nothing in place that's saying that is going to stay or that's going to go. We haven't got that information. We won't have that until that meeting goes ahead the week before the 21st of June. But we'll see. Obviously, it's everyone's choice. If you still want to wear the masks and do that, that's obviously your choice. But no, we don't know any more than you, unfortunately, when that's going to happen. Okay, has anyone got any more questions?
I think that's it.
Thank you, Paul.
Can you just confirm the next video forum date then, please?
Yeah, 2 seconds.
Is it the 17th or is that one being?
We're going to.
Sorry, that one's been changed to the 1st of July. I'm going to update the website probably in the next day or 2.
Yeah, we're going to have one on the 1st of July, hopefully. We're hoping that we might have the guides badge to look at by then. They might have created their badge, so that would be nice if we can have some more information and an update from them. So they would have done a few weeks on that, so that would be very good. Okay, anyone else got any questions? Okay, right, well, we'll leave that for there. Thank you very much. We'll get the bulletin out, make sure everything's on there for you, Nigel, and we'll send through the invite for the 1st of July. Sorry, yeah, and we will continue with the bulletins. Okay.
Okay, thank you.
Thank you very much.
Thank you. Bye-bye.
Thanks. Bye.
Bye.
Thank you very much. Thank you.
Bye.